Welcome to SVG-TV News for Friday, February 28, 2020. I am Rochelle Batiste with the details. With the coronavirus or COVID-19 spreading to many countries across the globe, the World Health Organization today called on all countries to be realistic about the virus. Here at home, trained infectious disease specialist Dr. Conrad Ned said there is a need for more public awareness education on the virus. Dr. Ned said it is important that persons are prepared and be vigilant at this time.
Fortunately, we are not aware of any cases in our region at this point, but we believe that with this illness, soon to be named a pandemic because of the number of countries that are affected, that it may be a matter of time before we are affected in these islands. So in terms of preparation, I think the public health actions that have been taken in terms of sensitizing persons to the nature of the illness, the things that we'll need to be doing at the time, would be very important.
At his clinic, Dr. Ned said his patients are very concerned about the virus as he is often questioned about it, with most persons wanting to know what they can do to safeguard themselves.
We have had a few persons who came in and with concerns about the coronavirus. I think most persons are aware that it has not yet arrived on our shores, but they ask questions like what they might need to have in case of illness. We are depending on the international community to provide some of that information for us about what medicines might be useful. There is need for more public education, more awareness, health officials coming out and speaking more about how to prepare, but not necessarily to create any stir or panic, because this is the way we would treat a viral outbreak of this nature. We're still at this point trying to understand more about the virus itself, how it makes people ill, and what really is the mortality rate.
The infectious disease specialist said other than the health authorities, businesses and other workplaces have a role to play and should ensure proper hygiene is enforced at this time, noting that at his clinic they have done their own preparations.
Because we're on the front line here at this clinic, we have already put a few things in place. Our staff has access to PPE, which includes the N95 standard masks, and I feel like we may have to have some protocols for if we were to come across a suspected case. For a small operation like this, you know, an infection or a suspected infection would have the power to close operations here for some time. So it's something that we're concerned about. We should really be using always in between patients hand sanitizers. Staff should be using them regularly. Patients have access to them. So it's to minimize transmission within these walls. But we want to encourage people to practice regular hand washing, soap and water, along with the use of these hand sanitizers.
In a news release issued this afternoon, the Ministry of Health, Wellness and the Environment says based on the expansion of the COVID-19 outbreak in many parts of Europe and Asia, Italy has been added to the list of areas from which travelers will be quarantined for COVID-19. In addition to the People's Republic of China, where COVID-19 surfaced, effective Thursday, February 27th, travelers from Italy, China, Singapore, Macau, Hong Kong, Japan and South Korea will be quarantined for 14 days. The ministry further noted in the news release that there have been no reported cases of COVID-19 in SVG and the Caribbean region. It, however, noted that during the period February 7th to the 27th, 2020, a total of 20 persons were quarantined. To date, 17 persons have completed the 14-day period, including 3 persons who tested negative for COVID-19 after 2 of them were noted to have low-grade fevers. 3 persons remained quarantined, having traveled from Japan and Italy. Thanking the general public for the support, the ministry encourages persons to continue to take the following steps to avoid the spread of respiratory illnesses. Wash hands with soap and water or use an alcohol-based hand sanitizer. Cover nose and mouth with a tissue when cough or sneeze. Avoid close contact with people who have flu-like symptoms, and do not go to school or work if you have the flu. The ministry says it will continue to provide regular updates on COVID-19 and other public health issues. In other news, 2/3 of the 45 unemployed Vincentian nurses were recruited by the Global Learners Program team to work in England. The Global Learners Program is a program designed by the National Health Education of England to manage the recruitment of overseas nurses for the UK government. At a press conference yesterday afternoon, Minister of Foreign Affairs Sir Louis Straker said that with a surplus of nurses here in SVG, the government contacted its High Commissioner in England seeking employment opportunities for the unemployed nurses here.
This has been through the hard work of our High Commissioner in England, Senior Lewis. We gave him the marching orders that he has to help us find hospitals in England that would be able to absorb these nurses. Now, this has not come very easily. It has come through hard work that he had to put in to make contacts here, network here, and able to have them come to St. Vincent the Grenadines. We should bear in mind that this is the only Caribbean island that has been successfully entertain this Global Learners Program in order to have recruitment of nurses in the Caribbean.
So Louis said 16 local nurses will be leaving on March 10th to take up employment in the UK.
Now, Michelle Thompson was here last year, January, and they interviewed nurses, and 16 of the nurses are in the process of getting their visa to leave here on the 10th of March. Now, it has taken a little longer than all of us expected, but that was the first time we were doing this, and that probably has set a template for this batch that would be recruited. They would be leaving no later than the end of October.
The Foreign Affairs Minister thanked the SVG UK High Commissioner for his effort in helping young Vincentians to seek employment in the UK through the Navy, Army and in the nursing field.
But we want to thank the High Commissioner Lewis, who has been a dedicated public servant. High Commissioner, bearing in mind that this is in addition to the 700 young men and women who are now in the United Kingdom Navy because of his efforts, and there are better and greater numbers to come in another area that we cannot speak of at this time. And we want to thank Michelle for bringing back her team here and for the Global Learners Program to come here. They have been here a whole week. They have been very diligent and hard at work in interviewing these 45, should have been about 48, but some didn't show up. These 45 nurses who were interviewed, and I think the passing rate has been very high. About 2/3 of them have already been successful and would move on. The others would have, most of them would have a second chance to do the interviewing again.
Persons with mental health issues face many challenges, including stigma and abuse. With this in mind, the staff of the Mental Health Rehabilitation Center will be hosting a walk to bring awareness to issues relating to mental health next Saturday. Counselor at the Mental Health Rehabilitation Center, Elika Matthews, said the activity will be held under the theme "Don't Call Me," which is part of efforts to bring awareness to the verbal abuse many persons with mental illness face and bring about change in the society.
Awareness to the names that we can use to refer to mental health patients. Sometimes we use names that can be quite harmful, such as crazy, bad-minded, lazy, and things like these. And we just want to bring awareness to let persons know that behind those names, it's an individual. Every patient is an individual, and we should be mindful of what we say to them and the names that we call them. So we just want to encourage persons to come out. The walk will be from E.T. Joshua Car Park to the Caliper playing field. Thereafter, we will have a soca size activity. Cool. Hold on, there was something else. For persons who want to come to the walk, you can call the Mental Health Rehabilitation Center and let them know that you are interested. The packages will be delivered to you. It's $30 for an individual package and $25 for groups of 10 or more. The number at Mental Health is 458-4240 or 458-6185. So we just want to encourage persons to come out, and we'll also like to say a big thank you to our sponsors, because we could not do this alone. So thank you to our sponsors, and we want everybody to come out and walk with us for the first ever mental health awareness walk.
Social worker at the center, Roselle Solomon, said the words people use to label one another can have a devastating impact on one's psyche, and the walk is being used to educate the public. She said it is important for persons with mental health issues to be treated with love and respect.
Therefore, we are extending this invitation to you to come out and participate. Yes, exercise is one of the benefits and it helps your mental health. But for this cause, we are trying to destigmatize. We are trying to have persons understand that labels and stereotypes, they bring a level of making someone feel as if they're not valued. And we want you to understand that persons with mental illnesses, they are valuable, they can contribute to our society, and they do need our love, care, and support. So when you come to this walk, we're going to make sure we give you some information. We're going to make sure that you leave there with loads of information. You're going to be happy. You're going to understand that we are working towards making sure that mental health and mental health issues are on your brain, and therefore come out, have fun. Families, friends, private sector, public sector, come out and be part of our mental health awareness walk. Bring your families, come enjoy, have a good time.
Solomon and Matthews used the opportunity to encourage persons who have family members at the rehabilitation center to visit them, noting it usually helps with their rehabilitation.
As part of the psychosocial team at the Mental Health Rehabilitation Center, along with the nursing staff and the medical staff, we are inviting families of our inpatients to come and walk with us. Come and visit your families. Come and just be present in their lives. We know that support is one of the major factors in rehabilitation and just making persons feel that they are truly appreciated. So we are just pouring out to you. Come visit, come be part of their lives.
We just want to remind persons that mental health is a shared responsibility, meaning that we at the mental health, we cannot do it by ourselves. That's why we're encouraging friends, family members to become a part of the process, because it's important for our patients to have proper social support if they're going to do well outside of the institution, which is what we want for every single patient, to thrive outside of mental health. We are encouraging persons to come and visit their family members, have a conversation. Let's see how we can better improve their relationship and how we can get patients back home where they belong.
22 persons from 16 business places here will have the opportunity to showcase their public speaking skills in the National Corporate Public Speaking Championship. The preliminaries of the competition is expected to begin on Saturday, March 7th, with the participants discussing the topic, Customer versus Employee. Is there really a debate? Chairperson Arlette Miller said the competition was created out of a desire to develop the young professionals' public speaking skills, and that this year's competition is shaping up to be bigger than the last.
There are a lot of young professionals in business places, and we were thinking of how we can help these business places with their professionals. We know that the media likes to push a mic in their faces and say to them, speak on issues. And we have seen persons clam up from time to time. So we thought that this would be a very good idea to help business places with getting their professionals exposed to the world and to learn to speak right off the cuff. So hence the reason why National Corporate Public Speaking was birthed. Actually, last year, even from the semifinals, we realized we had outgrown the venue, which was then the Girl Guides Hut. The semifinals was just packed, and so we knew coming into the second annual Public Speaking Championship, we had to source a bigger venue, hence the reason why we've gone to Russell's Auditorium. Yes, we're expecting, as you quite rightly said, quadruple the number from last year. And we're asking the business houses, we're asking the public to come out and support these young professionals. We have, this year, as a matter of fact, when persons look at the lineup that we have speaking this year, persons were saying that this is competition at its best, and I will quote one of the committee members' own words. Last year was the trial, this year is the real thing.
Miller said the participants are not being left to prepare alone and highlighted the work being put in to prepare them for the competition.
To send persons in this competition, we do not leave the participants stranded at all. As Toastmasters, we work with them. So first, there is a participants group where I am part of that group, and we have the deputy chairperson, Tamira Brung, also part of that group. The PR chair is also part of that group. We have been working with them. We have been going through. We had a session with them on the judging criteria, so all of them know what they're going to be judged on, and all questions that they have, we have asked them to ask the questions in the group, and we will answer them so that it benefits all participants. So no one has the advantage over the other participant. We have been working with them. At the elimination process on Saturday, we have 1 month with which to work with the semi-finalist participants, and we go into other training sessions. We've had a Toastmasters segment of watching and channeling your fare. We've had that session with the participants. 20 of them turned up for it. But thankfully, we were able to tape the session, so we sent it in the chat group, so all participants have benefited from that as well.
Chief Judge Glenda Matthews said the judges are well trained and they are making use of the Toastmasters format of their public speaking competition.
Let me say we started with 22 judges, but for the prelim, we will do 15 judges. Judges were pulled from Toastmasters and also from the public sector, business professionals. While it is not a Toastmasters event, we have adopted the Toastmasters judging criteria. So the participants will be judged on content, which carries 50% of the points, delivery, which carries 30% of the points, and language, which carries 20% of the points. The judges, they have been trained, and I would like to let all know that while the judges come from workplace where the participants may also come from, at no time would a judge and a participant be on the same level. So we will not have a participant and have a judge from that workplace judging that participant. So I would just like to make that absolutely clear. We have also adopted the acronym from Toastmasters, RISE. So it has always been respect, integrity, service, and excellent.
The Pan Against Crime 12th anniversary concert will take place this Sunday, March 1st at Retreat, Vermont. The program will begin at 4:30 p.m. with a session of praise, worship, and exhortation led by the Pentecostal Apostolic Faith Mission Church. There will be performances by the Police Band, Symphonics, and Epic Steel Orchestras, along with other cultural performances by students of the Dubois Primary, Vermont Adolescent Group, and the Police Youth Clubs within the district. During the event, the Vermont Police Youth Club would be officially launched. Remarks will be delivered by Minister of Sports and Culture Cecile Sesmaki, Commissioner of Police Colin John, and Deputy Chairperson of the National Commission on Crime Prevention Letitia Sandy, among others. The feature address will be delivered by founder of the Pan Against Crime Initiative, Minister of National Security, Prime Minister Dr. Ralph Gonsalves. The theme for the Pan Against Crime Initiative is Play a Pan, Arrange a Song, Build a Mind, Down with Violence and Crime. Meanwhile, residents of Vermont and the surrounding areas are being notified that due to the hosting of the Pan Against Crime concert scheduled for Sunday next to the District Health Clinic, the portion of road from the Retreat Bridge leading to Pepper Village and Francois will be closed to vehicular traffic during the concert. Commuters in the affected areas are advised to use the new bridge in Top Vermont Culver turning spot as an alternative route.